Hey, this is Dr. Karan from Dr. PK Live. I want to talk about sleep apnea, a very common issue, and some basic information for folks out there. So, what is sleep apnea? Sleep apnea is a condition where your breathing repeatedly stops and starts during sleep, and the most common type is obstructive sleep apnea (OSA). Now, these pauses in breathing can last 10 to 30 seconds or more and happen dozens or even hundreds of times at a night, depending on the severity of sleep apnea. It could be mild, it could be moderate, and severe. So, your body and brain are constantly jerked out of deep sleep to restart breathing, which leads to poor sleep quality and oxygen deprivation. What are the signs and symptoms or red flags? They include loud snoring, choking or gasping at night, morning headache, excessive daytime fatigue, trouble focusing or memory issues, irritability or depression, high blood pressure. Often it's the partner who notices first. So if your spouse says you stop breathing at night, believe them. Well, some spouse they sleep separately in the bed. In that case, somebody has to make an effort to stay there overnight and see if the other partner is snoring or having apneic episode. And if you live alone, then turn the camera on your phone and tripod, and you can record yourself, or you can use different sleep app available, and that will give you some idea. What are the risk factors? Who is at risk? Overweight or obese individuals. Neck circumference, like this neck circumference is more than 17 inches in men and more than 16 inches in women. Family history of sleep apnea. Males, although women are underdiagnosed, age over 40, smoking or alcohol use, nasal congestion, or deviated septum. Even people who appear fit can have sleep apnea if they have a narrow airway or they have other anatomical risk factors. So just because you are thin doesn't mean that sleep apnea is not going to happen to you, but it's much less common than the people with overweight. What are the complications and why people should get treated, and what are the complications if untreated? The sleep apnea isn't just about snoring, it's about long-term health damage. Untreated sleep apnea can cause high blood pressure and resistant hypertension. It can cause heart arrhythmia, heart disease, stroke, and heart failure. It can lead to type 2 diabetes because of increased insulin resistance in your body. It can lead to chronic fatigue and work accidents. I had patients in the past where people behind wheel have fallen asleep and gotten into accident. It can cause depression and anxiety, cognitive decline, and dementia. It even increases risk of sudden death during sleep in severe cases. How is it diagnosed? The test includes home sleep apnea test. It's easier, more accessible. It's a 2 night sleep test, and there is a sleep study in a lab called polysomnography. Monitoring includes oxygen, heart rate, breathing effort, and brain waves. So what does the study show? They calculate something called apnea hypopnea index, AHI, and that tells us the severity. 5 to 15 is mild, 15 to 30 is moderate, and more than 30 is severe. What are treatment options? Lifestyle changes, most important. Lose weight and start losing 10 to 15 pounds and more, so it'll help you. Avoid alcohol and sedatives. Sleep on your side, not on your back. Avoid heavy meals before bedtime. There's a treatment called CPAP, continuous positive airway pressure. It's a gold standard. It keeps airways open during sleep by providing positive pressure. Because during sleep apnea, usually airway collapses, and that leads to cessation of breathing. Many patients hate CPAP machine at first, but once they adjust, they feel energized like never before. There are option of oral appliances custom made by dentist. It's called mandibular advancement device, MAD, and it repositions jaw to open airway. There's surgery available in select cases called UPPP, uvulopalatophalangioplasty, and there's also a device called Inspire device. It's implanted to stimulate nerve, hypoglossal nerve in your tongue. Natural support, nasal strips, dilators, saline rinses for congestion, herbal anti-inflammatory support like turmeric, quercetin, and ginger can help. And always treat nasal allergies or GERD before, because they can worsen your apnea. So it's really important that if you have nasal congestion, that needs to be treated. If you have deviated nasal septum, that needs to be treated by having a corrective surgery. What are the prevention strategy? Maintain a healthy weight, treat nasal allergy and sinus issues, avoid sleeping pills and alcohol at bedtime, strengthen throat muscles with targeted exercise, practice good sleep hygiene. Now, it's interesting stuff here. Singing and didgeridoo playing have actually been shown to reduce mild OSA by strengthening airway muscles. So singing helps. So if you're a singer, then you can start singing more often. And also playing didgeridoo can help to strengthen your muscles. What can you do today? Well, there you can find out. You can go on internet and you can fill out Epworth Sleeping Scale. It's called ESS, Epworth Sleepiness Scale. You can fill out the form and see what's your risk factor. If you snore or wake tired, ask your doctor to do the study for you. And you should try CPAP or oral appliances if you have been diagnosed. Use weight loss, herbs, sleep hygiene. Don't ignore daytime fatigue. It could be because of undiagnosed, untreated sleep apnea. So it's really important that you take care of yourself, and everything starts with eating right. If you eat correctly and holistically, healthy, and then you maintain healthy weight, you don't have to worry about obesity, sleep apnea, diabetes, hyperlipidemia. So it's a metabolic problem that leads to all these diseases. And I'm going to be posting more stuff for common medical issues people are facing every day. So thanks for being here. Remember, rest is not a luxury. It's essential to your survival. Let's protect our sleep, our brains, and our hearts. Don't forget to like, subscribe, and join us next time. And this is Dr. Karan, Dr. PK from Dr. PK Live. You can check out the website www.drpklyfe.com. I have herbal products on Amazon and Walmart. You can check them out see if you want to buy any of them. Thank you for watching.